Hello everyone, welcome back to my channel. I am Dr. Shomita Roy, pediatrician, and today we are going to discuss six most important and potential MCQs in pediatrics for your upcoming NEET PG and INICET exam. Okay, so let's begin with the first one. What is the protein requirement of a preterm infant? So you see, students, the question you are getting preterm, not term. Okay, so in preterm, the protein requirement is 3.5 to 4 gram per kg. Okay, and in terms, the protein requirement is a bit low, that is 2 to 2.2 grams per kg. Okay, so this is basically a one liner, student, and here the answer will be definitely option D, right? So moving on to the second MCQ of the day. Okay, so, read it carefully, students. This is a problem based question. A 9-year-old male presented with poor growth and appetite and recurrent chest infection and steatorrhea. So, the child is most likely to have which of the following? So, for that, you need to first do the diagnosis, okay? And after diagnosis, you can do give your right answer, right? So you see the options. First is high chloride in sweat, next is mental retardation, C is recurrent skin allergy, and the fourth one is diabetes insipidus. So again, you see it's poor growth, poor appetite, recurrent chest infection, and steatorrhea. So what is the diagnosis, student? This is a case of cystic fibrosis, right? And in cystic fibrosis, what do we get? We get high amount of chloride in sweat, okay? So we do a sweat chloride test and that the value is more than 60. Okay, this is also an MCQ which can maybe asked, okay? So, and regarding cystic fibrosis, this is an autosomal recessive disorder, okay? And this causes a multi systemic involvement, okay, and it mainly affects the exocrine functions of respiratory tract, pancreas, liver, right? So here the answer is high chloride in sweat. So this is option number A. Clear? Next, moving on to the third question of the day, and that is enzyme replacement therapy is available to treat few metabolic diseases, and enzymes are linked to which substrate for the therapy. So, you know, students, ERT are available for so many storage disorders like lysosomal storage disorder and so on. Okay, so that all those are important for your MCQ from your MCQ point of view. Okay, but here question is asked that this enzyme is linked to which substrate? Okay, and the options is glucose 6 phosphate, mannose 6 phosphate, fructose 6 phosphate, and galactose 1 phosphate. So here it is linked to mannose 6 phosphate. Okay, so here the answer will be option B. Clear? So moving on to the fourth question of the day, and that is full outline of unresponsiveness score, that is FOUR, used as a coma assessment score in pediatrics age group, includes all of the following parameters except, so you see the options, it's eye response, motor, brainstem reflexes, and verbal output. So basically, students, all of you are acquainted with something called Glasgow Coma Scale, okay? But you are not much acquainted with the 4 scale. So this may be a potential question for your INI set, right? So you know in GCS what are the parameters we look for. Basically in GCS there are three things, okay? So eye opening, verbal, and motor response. So we do EVM, and this 4 score is having 4 things: eye, motor, brainstem, and respiration. So the mnemonic is E. Instead of V you will do B, M, R. Okay, so EBMR. Okay, so the answer we will be what? Yes, the answer will be your option number D, that is verbal output. Okay, so as because all of you are knowing GCS, most of you will tend to do option number C, but no, this is 4 scale. This is something different from that of GCS. Okay, so next, moving on to the fifth MCQ of the day. Mother's hind milk is rich in which of the following nutrients? So this is basically a very easy question, student. So there is something called foremilk and something called hind milk. Foremilk is rich in protein, lactose, water content. This is thin and this quenches the thirst of the baby, right? Hind milk is rich in fat. This is thick and this satisfies the hunger of the baby. Okay, so this is option number C, that is fat. Okay, so moving on to the last MCQ of the day. You see, a 4-year-old child presented to emergency with features of raised ICT, what should be the target goal of CPP in this child? Okay, so look at the age, this is 4 years. So basically, had the question been asked the target ICP, the answer would have been below 20 mmHg. Okay, this is also a potential MCQ, but here this has been asked CPP. So what is CPP, students? This is cerebral perfusion pressure. Okay, so this is different age wise. Okay, so from 2 to 6 years the target is below 50. From 7 to 10 years the target is below 55, and from 10 to 16 years the target is below 65. All are in mmHg. Okay, so here as it is 4 years of age, so definitely the answer will be below 50. So this is option B, right? So hope this was useful, students, and we'll be meeting soon again with lot more important MCQs and other informations, right? Thank you.